Another question, and I know we need to wrap things up here soon, so I want to be respectful of your time. What if you're looking at this field as a this is obviously kind of bleeding edge of where we're headed? What do you foresee stem cell therapy becoming a first line treatment for? Are there things that you see we just may completely reverse a treatment paradigm for at this point?
Yes. A lot of the chronic inflammatory conditions, a lot of the autoimmune diseases. And I would like people to start thinking not from the disease perspective. Even though when disease comes on, we can use stem cells. But if we can start using stem cells and integrated medicine to prevent diseases, all of a sudden, we're going to reduce the incidence of chronic illness so sharply that it's going to be mind-boggling. For example, if we can reverse aging, keep a person younger, 7 years younger than their chronological age, we can reduce the rate of chronic disease by half. So that's what research has shown, right? And I do believe if we can start regular IV stem cells, you don't have to do it that often when you're younger, maybe twice a year, start in your mid-30s. Then I'm very confident that we can slow the aging process down easily by 15 to 20 years. And I do believe that we may be able to cut down the rate of chronic illness by 75%. So that's really where I think we should start, which is for make sure people don't get sick at all. That is a crucial part of the future of healthcare. Yeah. And then if people do get sick, stem cells should be the first line, because no matter what illness you have, you want to amplify your immune response. You want to amplify your body's ability to repair and to fight off problems. So stem cells, if you got hurt, you had trauma, or if you have to do surgery, if you got sick with infection, anything that you've got, you should do stem cells as one of the first things that you do, because whatever else you do is going to make it so much better. I liken stem cells as the engine of the body. These are the intelligence, right? These are the DNA is driving all the repair, is ability to respond to the environment. Everything else you do, the vitamins, the minerals, the peptides, the, ozone therapy, the energy treatments, all these are fuels to the engine. So you're not going to run a good car if you don't have fuel, for sure, right? You need the fuel to run. But if you put incredible, pristine fuel into this dirty, dying engine, you are really just not going to perform very well. And same thing, if you have pristine engine, you put all kinds of dirty fuel, like horrible things into the body, you're not going to do well either. So you got to be integrative. You got to look at the body as a whole. So I hope doctors don't give people the false hope saying, oh, stem cell therapy is going to cure everything. This is end all be all. Then we're really reducing ourselves to the old medical paradigm, which is, we find A to B relationship. We give you one thing that cures everything. That is so arrogant. You are not respecting how complex the body is. So as a stem cell doctor, that's why I named the academy, American Academy of Integrative Cell Therapy. You've got to integrate. The cells don't work in vacuum. Yeah. So that's what I think it's going to happen, is that you are going to put some engine in the body, whatever that's going on. And that's going to be one of the first line of treatment in the new medicine.
Any commenters in your literature out there on a treatment infusion-like paradigm, how often you should be getting it just for anti-aging purposes?
I think right now, for example, they've done some research in animals, and they were giving rats, I think every 2 weeks. I think the more middle-aged rats, mice or rats, they were giving once a month, but they only live for about 18, 20 months. So they were giving them once a month, right? Yeah. Or if they're older, I think they were giving them every 2 weeks. So if you look at the frequency of that, and then you look at how long the cell's living in the body, we're not God. So we don't know exactly, but a good educated guess is 3 to 6 months, a treatment every 3 to 6 months. I think you can do more. You can do every 2 months or even every month. I don't think it's too much, especially if you are older. But in general, I think every 3 months is a good interval. The rationale is that the cells will live in your body for about 3 months, and all their signals and effects will last for another 3 months. So if you always want some signals in your body, then every 6 months. But if you always want some cells in your body, every 3 months.